My name is Kara Adams, and like Jamie mentioned, we're from the Tennessee Disability Coalition. And just a little bit about the coalition. The coalition is a statewide affiliation of about 45 programs or organizations that all deal with families and individuals with disabilities. The coalition itself has programs inside underneath it. So one of them is Benefits to Work, and Benefits to Work is a program that helps people with disabilities figure out what their benefits are when they go to work. We also have a policy and program that really just works on the legislative level to be advocates for individuals with disabilities. We have a program, Project Brain, that was active actually here at Fort Campbell area, and that really focuses on kiddos that have traumatic brain injuries. And then we have our final program, which is ours, which is Family Voices of Tennessee. And Family Voices of Tennessee is a statewide program that really focuses on families and kiddos with special health care needs, chronic illnesses, or disabilities. And we provide support systems and information and resources. So a little bit about me, and just is my name is Kara Adams. I'm a military family. My husband is actually active duty. He is in South Korea right now. So my son, Kale, is 11 years old. He is actually active in the EFMP program. We live in Nashville. He was born with a rare and complex congenital heart defect, an anomaly of different defects. He's had over 20 surgeries and procedures, including 3 open heart surgeries. Because of the defect, he also has some neurological developmental issues. Primarily, we deal with ADHD right now, and that preteen stuff, that's no fun. Y'all know what I'm talking about? That's like, yeah. And we have a little bit of social issues, but we're doing well. So we know this world a little bit more than what we would like, right? But it's also been able to provide us a way to help other people. Kel is doing well at this point. He will have more surgeries in the future, so we're not done. But we are very fortunate that we live where we live because we do have wonderful affiliations here with the EFE program at Fort Campbell. And not only that, but we also have wonderful hospitals that we're able to take our son to that he receives care. So I wanted to give you a little bit about that, background about us, because we're coming from a place where we just get it, we understand. And I'll let Tanya introduce herself.
My name is Tanya Bowman. I'm a mom of 3. My daughter Jasmine, who'll be 15 next month, was born at 24 weeks. Spent 4 months in the NICU, multiple ups and downs. Even after she came home from the NICU, we had an episode and had to go back to the hospital. So we spent the next 1.5 years in and out of short stays, longer stays, doctor's appointments, feeding therapy, OT, PT, you name it, we did it. And she was on oxygen when she came home from the NICU, and we stayed on oxygen until she was almost 2. So at the time when Jasmine was born, I was a probation parole officer, so my whole life flipped when she was born, and so that's how I got propelled into this field. I have 3. My youngest son also has sensory issues, so he's done OT, PT, and a speech delay, so very well vested into dealing with helping families and that we understand the journey that they're on. And this is the definition from the Department of Human and Health Services regarding what defines children and youth with special health care needs. Those who are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type amount beyond that required by children generally. So that gives the overview of what Department of Human and Health Services Maternal Child Health Bureau distinguishes as children and youth with special health care needs, and which then you can change to individuals as they grow older and become young adults, and same thing would apply.
Within the ACA and the way that things are moving forward, there are hospitals, providers, everybody is going to be judged. They're going to be, their reimbursement is all going to come into effect with their patient and family center care satisfaction surveys. And what patient and family center care, and this was adapted by the Institute for Patient and Family Center Care, is an approach to the planning and delivering and evaluation of health care that is grounded in a mutually beneficial partnership. That's very important, mutually beneficial. If I can talk today, beneficial partnership among healthcare providers, patients, and families. So what does that mean? That means that it is a partnership between you and the healthcare provider. That means that you're working side by side each other. It's not one telling the other person what to do or how to do it. It's a collaborative effort. And that is where healthcare has been moving for the last 5 years, and it's going to continue to move that way, to have that mutually beneficial partnership. And now even more than ever, that the surveys are coming out and patient engagement is so important that they are going to be rated on this. We as family members, as patients, we have an obligation to have a voice, and a voice that's of integrity. So we are able to walk side by side with our, even if it's at the bedside, right? If it's at the bedside with our family member as a patient, or if we're sitting down at the table and talking about family leaders, and we do talk a little bit about family leaders and family engagements and how to really become working on policy and program as a family member. The core concepts of patient and family-centered care are dignity and respect. That seems to be pretty reasonable, right? We all want to be treated with dignity and respect. Information sharing, this one's important. So just as we as a patient, an individual, or family member, we want to get all the information that we need so we're able to take care of our family member, we should be providing that same information to the doctor, even if we think it's silly. Because at the end of the day, we all have the same goal, and that's to make sure that we get out healthy and well and be successful in life. And obviously participation, so the participation is going to be at your level, right? Some people don't want to sit at the table and do like Tanya and I and sit here and talk in front of lots of people. Some people want to have different, and depending on religious beliefs or their culture, their participation level may vary. But it is your choice as a family member, as a patient. And of course, collaboration, that goes back to that mutually beneficial partnership.
And this is the medical home approach, just in general, that for caring for families in general, just having that system of care. That would include the children and the families, your subspecialty providers, your primary care providers, as well as community resources. So it all goes together for the wellness of the child. So that medical home approach, that it stems, but everybody's in communication with each other, that it all works together for that benefit of that family.
Does anybody have heard of the concept medical home? Yeah. So Fort Campbell and Blanchfield has been recognized by the Institute for Patient and Family Centered Care for their medical home model. So it's kind of a really, and Jamie's like, yeah. It's really important, and again, this is where healthcare is going. This is what they're pushing, so it's important for us as family members and also people that are working with these families to understand and kind of know this concept.
And these are some components of a medical home that would include being accessible, having compassionate care, comprehensive care, which would include all the subspecialties or being connected to those subspecialties, continuous care, that the care is coordinated, because usually if you have a child with special health care needs or disabilities, there's lots of appointments and lots of things going on, so you need that continued coordinated care. Culturally effective. People come from different cultures, and cultures means many different things. So being sensitive to those things in part of your medical home. And family-centered. Family-centered meaning that you're at the table with those mutually beneficial partnerships that Kara mentioned earlier.
And just kind of a little reference, so Tanya and I both work with the Department of Health with children and youth with special health care needs. One of my roles is a family consultant for all their Title V programs for the maternal and child health programs. And we worked on what's called the needs assessment this past year, and that is really to engage what the needs are for the state of Tennessee when it comes to women and children. And what they determined was in the next 5 years, one of their priorities was going to be medical home. So it's very important. So that's what the state of Tennessee is going to be focused on. That in transition, which we're going to talk about in just a second. And going along with medical home, one of the most important things is coordinated care. And that's just something that I think every facility and provider and just organization struggles with, right? That communication aspect of it. And it's really important for us as family members to know that that is available, that we don't have to search for those answers ourselves. And this is one of the most important things that the medical home model will bring. And just FYI, if anybody has any questions or has something to say, just shout out. We're very informal.
Yeah, if at any point, just ask any questions anytime. And so this is going into what we said about transition. And that really, and everybody emphasizes that it really starts early. And we've had parents at workshops before that waited and that have said that they wish they'd known to start earlier, to start planning for a transition, and that it really comes up on you really fast. So the earlier the better, especially with a child with special health care needs or disabilities, to get those plans in order to think about things or how you want their life plan to go as they age and get older. And these are a couple of guidelines. There are some websites that if you email me or contact me, I can give you. One thing that been out to different trainings about doctors' policies, because usually 18, you're out of the pediatric office. But some do have children who serve families who have children with special health care needs or disabilities. They may let you stay longer, but it's always good to ask before you get to that point, and they're like, oh, you need to find an adult, health care provider. And that's really scary, especially if they don't recommend one or whatever condition, or that the adult health care provider may have no clue. So that would take a process of you vetting some adult health care providers. So knowing if at 18 you're cut off from your primary care provider who serves the pediatric, then that would be good to know, so you can start planning that process. Or if they say you can stay, that's a different, scenario. So that's one thing to find out, so you wouldn't be, blindsided, like, oh, well, now you've got to go find someplace else, they're 18 and it's cut off. I mean, just to plan, like, my daughter will be 15. She's already been participating, like, in her IEPs. Now we have the occupational diploma to do on a work track. That may be our focus. We're just trying to figure out some things now that she may want to do. And so we do have that option of, like, if we decide to do a work track, then she would go to placements, because that's part of what we have there. And I know every place doesn't, they don't do that. But our sophomore year, we can start saying if she, whatever it may be, like, well, let's start at, Marriott and let's learn some work skills, and that would be part of her IEP, part of that occupational part. So she's gaining those skills because that was built on what employers would want in terms of if that's her track to do work related. So she would be building those skills, bringing in vocational rehab.
Are you familiar with vocational rehab? No. So that's their whole goal, is to help find jobs for individuals that might need just a little assistance. And they have usually are assigned a coach that is help them to do whatever job that it is that they're able to do. So that would be a good place to start. You fall into the category of a lot of families that service is cut off at 18 and sometimes 22, yeah. And we're all in the same boat. But there are, like, certain things, like Tanya said, doing that fast track, and then also I would do the vocational rehabilitation programs. The benefits to work flyer at or brochure that they gave, that's also a really great organization, because they are really heavily invested in the transition program right now for family members and for employers, and they're doing a lot of different trainings specifically with transitioning into the workplace, and they're part of the Tennessee Disability Coalition. I would definitely encourage you to contact the Benefits to Work.
And there's also a flyer for Tennessee Works, which is about eligibility for working. They have lots of different workshops, different newsletters they send out. Just recently had an employment summit for parents, for providers, in terms of having meaningful employment for individuals with disabilities and special health care needs. And these are just other guidelines about choices. Certain things on that parent checklist that you would do, safety rules, things they know, exercising, hygiene is a big issue. Just making sure they know those basic things, safety rules, exercise, good nutrition, personal privacy and boundaries are huge, and just learning to make choices, giving them opportunities to make choices.
And knowledge, again, knowledge of the game, and this is kind of what we're going back to be independent and to be on their own. They have to know their diagnosis. They have to know what their limits are. They have to know who to call and where to call and who their doctor is. because a lot of times as moms and dads, we tend to do it all for them. Right, and so, but it doesn't necessarily help them whenever they want to gain independence. So it's really encouraging to take those first steps, even if it's asking. For instance, I asked my son, Kale, have you taken your medicine today? I know if he's taken his medicine today, you know, but it's him knowing I've got to take it at these times. Do you know your diagnosis? What is your diagnosis? What are you not able to do? What can you do? Because we have a lot of limitations in my world. So it's those little things that just understanding and then verbalizing and working with them to be able to work towards that independence. I think that's the biggest thing. And then, of course, everybody knows the ADA. I'm assuming everybody knows the ADA. And so we'll talk about, we talked about patient and family-centered care. Well, the ADA falls underneath that too, right? And we're working with providers, and underneath the ADA, healthcare providers have to accommodate. Point blank, that's it, end of discussion. And obviously reasonable accommodations. We're not going to have somebody sit there and brush somebody's hair or those things, but reasonable accommodations. And some of those things are enough trained staff available who can assist you for the transfer, accessible exam or patient lift, qualified interpreter, that's a big one. Everybody is required to have an interpreter if needed.
And family members don't, I mean, some people just, allow a family member. Family members should not be, they're not the qualified interpreter.
And nor should they be. Written material and assisted listening devices. And then also, it could also mean if you were in the emergency room department and you have a kiddo with sensory disorder and loud noises and loud people bother you, he should be able to be moved to another place where it's quiet. I mean, those are all types of accommodations.
And if it's a bad, my daughter may have trigger days, it's bad days, and if it's busy, if it's less busy in the afternoon, that may be the time to go because it'd probably be more beneficial for them too, just to know if it could be a smooth thing. So that's one thing, if you know that, your child functions better in the morning with less people or different things like that, that's important to know when scheduling because that can be helpful just to make everything go smoothly after all.
And we put this slide in here because it's really more for kiddos, but if your kids hear you talk to your provider and work with your provider, then they will be more entitled to be part of their own care. So these are just simple things that you can ask and that they can ask. It's very easy. What can I do to help my child or help myself? So now we're at the point where I'm in the room with my son, but his cardiologist is asking him direct questions, and he's asking his cardiologist direct questions. And we're encouraging that. Please tell me the whole truth about the situation, even if it's uncomfortable. So this goes back to that information sharing, right? Because sometimes as family members, we get information that's scary. We get information that's overwhelming. And as a healthcare provider, sometimes they don't want to give that information. But as parents and as family members that are encouraging our kids for that independent side, we need to know everything. I mean, everything. This is a big one, especially when we're dealing with kiddos. And they're right at that transition age. I don't know medical talk. So why would I expect my kid to know that same thing? So if they start doing that jargon, this is us for family members too, then can you please use layman terms? Put it in a way that I can understand. Kale's cardiologist draws me pictures. So I have more pictures of the heart than probably in the last 11 years than I ever wanted. And I think it's always okay to ask who you are, and it's always okay to encourage your kiddo to, or young adult, or big adult, to who are you, right? Because I think that as patients, we've always been a little bit afraid if they're a doctor or somebody coming in the room, we should automatically just trust them and expect that they know what they're doing. But I want to know who it is. I want to know who's handling my care, my child's care, my family member's care. So it's appropriate to ask, and it's also appropriate to teach our kids to do the same thing. And then also, I think sometimes we forget about the life course. We sometimes forget that everything affects our care. So we tend to leave out those little important things. So for instance, my husband's deployed. My son's 11. That affects everything. Right? So it's important for our healthcare providers to know those situations. It's important to know where we're coming from.
And starting early, regardless of whether we're ready or not, that it happens, transition happens. and it comes, and so you want them to be as well prepared as possible, and for you too to know the different things learn as much information as you can so they help them be prepared. Again, there's the reinforcement of start early. Start as early as possible, or start where you are if you haven't already started. Start the process. Reinforce lifespan skills. Prepare for the long haul, and it's a journey. You may take a turn. It may not be the right turn. It's okay. You can start on another journey as far as making a choice about housing, whatever it may be. No turn is just, sometimes it's trial and error. Assisting to learn how to extend wellness. That's it, hygiene, healthcare, good nutrition, exercise, which will help. And just, multiple checks of where are we now, what do we need to work on, what do we need to improve on.
And this is just a really basic overview of transition. Tanya does a really good presentation about getting more in depth with it, and actually is partnered with the ARC of Tennessee. So if you want more information, you can always contact us and we can provide that for you. Did you want to go over this? I know that you guys have been talking about Medicare and Medicaid. We threw this up there because sometimes it's really confusing about what is what. But you did a fantastic job with the Medicare, because I'm going, oh, I didn't know. Okay.
Yeah, we put the slide in about the SSI program, the federal program by the Social Security Administration. A lot of times we've had families that have applied with the income part, that they have the disability, but they apply while the family income can still be counted, and so then they don't get it. But then once the child turns 18 and then they're on their, just based on their own income, then they would be eligible for different criteria. You wouldn't be based on the family income.
Do you apply when they're 18 or before they're 18?
A few months before they're 18. That's the recommendation that's been from people that do it, that you don't do it right, you do it a couple of months before 18, at least 3 to 4 months, start the process. And this is on the part that it just says eligibility is based on the child and the parents until they turn 18. A medical determination of disability must be made by the doctor. Doctors ages newborn to 18 are eligible. Individuals 18 and older apply based on their own resources, not the parents. And it can be applied for at any time, through phone, in person, through your Social Security office. You would still have to submit documents, a recommendation, not original documents, through the mail, but you still have to provide that documentation regardless if you do it over the phone, that they would still need to see documentation of the medical determination and whatever supplemental information they may happen to ask for. And this is about our state. This is for Tennessee, state family support program, the things that cover. It's not based on income, one of the only programs that are not income-based that serves families. And the services that are available are respite, things that, home modifications, housing costs, counseling, different things that are, like I said, usually not covered by insurance, and it's not a service that's based on income that it can be applied through, and it's administered by our Department of Intellectual and Developmental Disabilities, the DID program.
And these are just additional resources that you can go to if you're talking about the medical home, to learn more about the medical home. You can also, obviously, medical home implementation, that's a huge thing. And then healthcare reform, obviously we're all in the middle of that. And I believe everybody got a checklist. This is just a sample of a checklist of some of the things, and we have more of these. And I just now realized we also have a wonderful booklet that we forgot. Now you just remember. It's called Dude, Where's My Transition? And it really helps those kiddos that are going through that transition process, and it uses in their terminology and gives them just something else to hold on to. So if you would like one of those, we can definitely send you one. That would not be a problem. I just now realized it. Sorry. The first part is, just like Tanya and I are family members of kiddos with special health care needs, our entire staff is. So we get it, we understand. We're all at different levels, we all have different circumstances and different situations that we've have been through. And we talked, so one of the things that we do at Family Voices is we really want to engage the families to be more proactive in not only their health care, but just be proactive in general. We really want that family voice, that family leadership. And in certain ways we can do that. So Tanya and I both are very involved in our state councils. Tanya sits on the Genetic Advisory Council. I sit on the Committee of Pediatric Emergency Care. And the reason why I'm mentioning these things because there are roles and places for every family member all across the board. Again, they're being having merits on family engagement, and they want to have that input because we are the consumers. At the end of the day, we're the one receiving the care. We understand what needs to happen. And that's not to say that it's going in there and pointing our fingers to say what is right is what is wrong. It's having that mutually beneficial partnership. So one of the things that we've done at Family Voices is we've created parent summits, and it's really opened the door for any family member that would like to take that leadership skill next. We had our first one last year, and we had a wonderful experience with Arlene Forlanza, who is a national family leader. She's also the chair-elect for the Association of Maternal Child Health Programs. So she came in and really talked to us about what it takes to become that leader, what it takes to move it to the next level, and understanding how policy works inside the healthcare system. Because as we know, public healthcare and private healthcare are really kind of moving together, and they're all being looked at the same umbrella with the ACA. And if you want to learn more about that, please contact us because we do lots of trainings on that. Our other program that we have is Tanya's.
Family-to-family health information. We assist families by, in general, being that sometimes just emotional support. They want to talk to another family member. Assisting with information that we can gather about insurance, private and public. We do workshops. We come out like this and talk to different groups, talk to families, just to provide that information that we have to share. And just work through some things. If they have questions, families can call us and ask different questions, and we don't know the answer, we'll find it and get the information to them. But being that resource of information, just even a starting point for families to gather.
And it's a free service. All of our programs are all free. Our other one, and this is our newest grant that we have, and it's through the Department of Health again. It is a HRSA grant. It's through the Children's Special Services Program. It is our Tennessee Parent to Parent, our matching program. And really what that is we are matching families together that have been through similar situations. It's as simple as that. So families come to us and they're a little bit further along in their journey, and they really want to give back, and they want to give back in another way. We train them on leadership skills. We train them on communication skills, on HIPAA, that's a big one, and really how to take care of yourself, because as family members we tend to not take care of ourselves, right? We kind of give to everybody else besides ourselves. So they go through about a 3-hour curriculum, and then after that they are certified to mentor other families. Right now we have over 60 mentors across the state of Tennessee with various different experiences and diagnoses, and even different languages, which is wonderful. And not only that, we built our model for Tennessee Parent to Parent off of a national model, Parent to Parent USA. It's in 29 states. It is an evidence-based model. So we're very excited to have it here in Tennessee. So if we're not able to find a match here in the state of Tennessee, then I'm able to pull from a national listserv and really communicate and collaborate with other states to find that family some type of support. We are not a counseling service. We don't give medical advice. We don't do any kind of psychological advice. We are family members helping other family members out. And I know it says parents reaching out, but we match siblings. We match advocates together. We match foster parents and grandparents, adults, family members that still have kiddos at home. So anybody that would like support, we're able to provide that match for them. What is really exciting, and I might be getting a little ahead of myself here, but I'm gonna go ahead and share it. I did get off the phone. I did talk with the DOD, and they want to also partner with Parent to Parent USA and create a mentor parent matching system for military families, which is really exciting. Yeah. So hopefully I'm really excited. That's one of my, obviously, personal issues as a military mom, because again, we all have issues that deal with nobody else has. So this is also a free program, and you all have brochures for not only the family to family program, but also for the parent matching program. It's very simple to really, if you want information, if you want to be a mentor, you just have to fill out a form and give blood and all. I'm just kidding. You don't have to do that. You don't have to do that. But if you want to be a mentor, there is a little bit of a screening process, and then there is a training. If you want to be matched or know somebody else that is matched, you can go to our website and they can really just request a match online. And that's all we got for you. That we were trying to do it fast. So.